Hi, my name is Aparna Ajarpu, and I'm a first-year medical student at the Carver College of Medicine.
Hi, my name is Mala Sharma. I'm a first year medical student at the Carver College of Medicine. And today we're going to be taking you through the human body and we're going to see different aspects of it.
Great, so I'm going to start off with the brain. And so we're going to point out various structures of the brain and see if we can identify them and name their function. So the first lobe we'll start off with is the frontal lobe, as you can see here. So the frontal lobe is for movement and for logic and reasoning, and basically allows you to move. The parietal lobe, as you can see here, is for sensory information and allows you to feel and respond to stimuli. The temporal lobe, as you can see here, is responsible for allowing you to hear. And the occipital lobe, in the most posterior aspect of the brain, is responsible for vision and allows you to see. And the cerebellum that's kind of hanging off of the cortex is for balance. So when you get a stroke, you get a transient loss of blood to parts of your brain, and that causes brain tissue to die and then causes deficits in function. So if you have a stroke in the middle of the right hemisphere, what would be the result? Well, you would not be able to move your left arm. And if you had a stroke in the left temporal lobe, what would be the result? You may have hearing loss in the right ear. And when we talk about concussions and sports injuries, if you get slammed in a tackle and get hit on the front of your head, where will most damage occur in the brain? Well, it would be the back of the brain, the occipital lobe, and it may result in a temporary difficulty in seeing.
All right, next we're going to talk about the heart. So the main function of the heart is to receive blood and also pump it out to the rest of the body. And so we're going to first go through the different structures and then we'll kind of go through how blood travels through the heart. So if you look at a human heart, we've got 4 chambers. We've got this one wall that divides the right and left side of your heart. And then we've also got these valves in the middle that kind of separate the top chambers from the bottom chambers. So your top chambers are called atrium, and then your bottom chambers are called ventricles. And so let's walk through how blood kind of goes through all these vessels. So we've got veins. So if you ever look at your arm or your legs, you might see these like blue squiggly lines. So those are typically going to be your veins. Veins are responsible for taking the blood from the rest of the body, so from like your organs, your muscles, and taking it back to the heart so that the heart can take it to the lungs and then receive it back and then send it out to your body again. So you're going to get all these veins and they're going to pool all the blood into this one major vessel. And this vessel right here is called your superior vena cava. So the blood is going to travel into your superior vena cava and then go into this top chamber called your right atrium. From your right atrium, it travels through this like valvular area and goes into your right ventricle. So this valve that connects your atrium and your ventricle is just called your right atrioventricular wall, or right atrioventricular valve. It does have a special name. It's called tricuspid valve. So you might hear it both ways. And then from your right ventricle, you're going to take all that deoxygenated blood and send it to your lungs. So we're going to talk about your lungs later, but just know that from your right ventricle, there's a vessel which connects to this part, and that's called your pulmonic trunk. And so from your pulmonary trunk, you've got these vessels called pulmonary arteries, which will take it to your lungs. And at your lungs, you'll kind of get that oxygen diffusion. So all your blood is going to carry that oxygen. And from there, you're going to go into these other tubes or vessels called pulmonary veins. So from your pulmonary veins, you put all that blood into this chamber. And so we're on the left side. So now this is called your left atrium. From your left atrium, you go into this chamber right here called your left ventricle. And just like we had the tricuspid valve separating the two, the atrium and the ventricle, you've got another valve on this side called the left atrioventricular valve. It also has a special name called the mitral valve, so you might hear it both ways again. So from the left ventricle, we are going to go into this aorta. And there's a special valve in there. It's called the aortic valve as well. So just know there's another valve. One special thing about the left ventricle is now this is all oxygenated blood and it's going to send it to the whole body. So your brain, your all the way down to your toes. So this part of the heart has to generate a lot of force and a lot of pressure. And how does it do that? It has all this thick layer of muscle around it. So if you look at the right ventricle, it has a little bit less muscle than the left ventricle. And that's why it's so big, is because it needs to generate that force to be able to push all the blood to the rest of the body. Okay, so once we go from the left ventricle through the aortic valve into the aorta, it gets carried to the rest of your body. So like your muscles, your organs, through things called your arteries. And so then it'll go to your muscles, it'll drop off all that oxygen we had, and then that blood, the deoxygenated blood, goes in through your veins, back again into the superior vena cava, right atrium, right ventricle, and that whole cycle starts over again. So typically at resting, your heart rate should be around 60 to 100 beats per minute, and that's usually when you're not like exercising or anything like that. But we do know when you're exercising, your body needs more energy or needs more oxygen, especially your muscles. And that's why your heart will start to pump faster. And that's why you'll get an increased heart rate when you're exercising. And that should be normal. And then also, if you've ever heard your heart through a stethoscope, or even if you just put your hand over your heart, you'll hear like a rhythm of 2 beats. So you'll hear like that lub-dub noise, if you've ever heard of that. The lub is when, the first part is when your AV valves, so your tricuspid and your mitral valves, when those close. And then the dub part is when your semilunars, which are going to be your aortic and your pulmonary valves, that's when those close. So you'll hear both of those. And yeah, that's just that's how blood travels through your heart. All right, so next we're going to go to the lungs. We just talked about the heart and how it works side by side with the lungs to get that oxygen into your bloodstream so that you can send it off to your different muscles and organs. So let's talk about the lungs. So first of all, we've got this windpipe, and this is called your trachea. So if you ever have like choked on water or food, it's usually because the food has gone into your trachea instead of your food pipe, which is called your esophagus. So all your air that you breathe, it's connected to your mouth up here, and it comes down your trachea. And then once it gets down over here, it splits into these 2 structures called bronchi. So you've got your right bronchi, and then you've got your left bronchi. And then these also further split even in to smaller tubes called bronchioles. And so once you've gotten into a couple of these branches, at the very tips, you're gonna have these grape-like structures, and those are called your alveoli. Alveoli is actually the site of oxygen diffusion. So once you're breathing in all that air, it goes through the trachea, bronchus, into your bronchioli, all the way to your alveoli. And then you've got these capillaries, which are just a continuation of those arteries I talked about, coming from the lungs. It has all that deoxygenated blood. It'll pass right next to the alveoli, and all that oxygen in the alveoli gets transferred to those blood cells in those capillaries. From the capillaries, you're going to go back into those pulmonary veins, if you remember, and then it gets into your left atrium, and then it can go back through the heart to get pumped to the rest of the body. And at that point, it's oxygenated blood. And so that is how you get oxygen from the air outside that you breathe all the way into your lungs, into that blood, and so it can travel to the rest of your body. And so a little bit about the 2 lungs that we have. You've got your left lung, and then you've got your right lung. So one special thing is that your left lung is actually smaller than your right lung. And the reason for that is if you think about where your heart is sitting in your chest, it is actually sitting on kind of your left side of your chest. And so that's why your left lung has to be a little bit smaller so that your right lung, or your heart can sit right next to it. And so just because I said like that left lung is smaller, you can kind of see this line right here. And that separates your left lung into 2 lobes. So you've got your superior lobe, so like your upper lobe, and then you've got this bottom lobe called your inferior lobe. Whereas on the other side, on your right side, you've actually got 3 lobes. So you've got this one fissure right here that separates your inferior or your bottom lobe from the middle lobe right here. And then you can also see kind of a line right here as well. And that separates your middle from your superior lobe. So yeah, that's just a little bit about your lungs. And these are all the structures that kind of aid in getting that oxygen to the rest of your body.
So now we're going to learn about the bones, muscles, and tendons in our body. So there are 206 bones in the body, and calcium is a substance that comes from nature and is in our food that helps keep our bones strong. So how much of the calcium in our bodies helps our bones and teeth grow strong? Well, over 99% of the calcium in our bodies does this, and the other 1% is needed for blood vessels, muscles, and nerve signals to work properly. So what types of foods should you eat in order to maintain healthy bones? And what is an important ingredient in these foods? Well, dairy products such as milk, cheese, and yogurt, canned salmon and sardines with bones, leafy green vegetables such as broccoli, certain cereal, soy milk, orange juice, and tofu contain a lot of calcium, which is an important ingredient that keeps your bones staying healthy and strong. Growth plates are the weakest areas of growing bones and are more prone to injury. And low amounts of calcium in the body can lead to weak bones and eventually osteoporosis, a disease that makes bones weak and easy to break. So let's move on to muscles now. So for muscles, how many do you think there are in our body? Well, we have 640 muscles in our body. And the three types of muscles are the skeletal muscle, cardiac muscle, and smooth muscle. Skeletal muscle makes up 40% of our body weight, and they help move our skeleton and are able to move voluntarily. Cardiac muscle is located in the wall of the heart, and we have no direct conscious control of how fast the heart beats, so they contract involuntarily. Smooth muscle is located in the walls of hollow internal organs other than the heart, such as the stomach, urinary bladder, blood vessels, and respiratory tubes, and they also contract involuntarily. So the functions of muscles are to produce movement, open and close passageways, maintain posture and stabilize joints, and to generate heat. We must eat healthy and exercise to produce well-working muscles. When it comes to our tendons, as you can see here, these are connective tissue structures that join skeletal muscles to bones. They send forces of contraction to the bone being moved, and they provide muscles with elasticity. They also carry the blood vessels and nerves that serve the muscle fibers.